Hello again. First, in this part, I want to show you the skin markings. This is the nevus or mole, and this is the localized overgrowth of melanocyte. And most of the times, this is benign, and we need to pay attention to its size and the border. This is the freckles, and the freckles are the yellowish brown pigment. They are overactivity of the melanocyte in some parts of the body, and this pigmentation increases with sun exposure. The other marking is called hemangioma, and here you can see the capillary hemangioma, which happen in the newborn and disappear by aging, and this is the benign tumor or overgrowth of the blood vessels. And here in this picture, you can see the cavernous hemangioma, which remain for the lifetime. So these are the markings of our epidermis. And now I want to talk about the next part of the skin, which we call it dermis. Look at this picture. In this picture, first you have epidermis, and beneath epidermis, you can see dermis. The dermis is deep to epidermis. The thickness of dermis is 0.5 to 3 millimeter. It's composed of connective tissue. We have many collagen fibers, elastic fibers, and reticular fibers in the dermis. And we have some motile macrophages or dendritic cell, which can work for our immunity. We have blood vessels, we have sweat gland, we have sebaceous gland, hair follicle, and a smooth muscle in our dermis. And the dermis is made up of two layers. One layer of dermis is called papillary layer, and the other layer is called reticular layer. Look at here. The papillary layer is the superficial region of the dermis. It's located deep to epidermis. Here we have areolar connective tissue, and we call it papillary layer because we have some projections or papilla in this layer. These papilla come up as you see here. We have some papilla or some invaginations from our epidermis, which we call them epidermal ridge. These epidermal and dermal papilla go in each other, and this interlocking and interdigitating connection can increase the surface of contact, and also it can make the contact become very strong. After the papillary layer, you can see the reticular layer. The reticular layer is deeper, it's thicker, and it's dense, irregular connective tissue. We have many fibers like collagen and elastic fibers here, and as you see in this picture, you can see the blood vessels. You have one muscle, which we call it arrector pili muscle, and this muscle go to contraction at the time of cold or when we're afraid of something. You can see the sweat gland here. You have the tactile receptor or sensory receptor in this part of the skin. And the function of this arrector pili muscle is contraction and erection of the hair. And you can see this goosebump skin due to the contraction of this arrector pili muscle. In our skin, we have lines of cleavage and also a stretch mark. In the skin, as you see in this picture, we have some parallel lines. These parallel lines actually can show us the orientation of collagen and elastic fibers. And as you see in these two pictures, these orientation are different in different regions of our body. In some parts of our body, they are transverse. In some parts, they are oblique. In some parts, they are circular. In some parts, they are vertical. So they are different in different regions of our body. But why they are important for us? They are important specifically at the time of surgery, Because when we have a cut or incision which are perpendicular to the cleavage line, due to the pressure of the collagen and elastic fibers, we have a large gap in the incision, and healing of this incision has delay. And when we have healing, you can see a scar tissue between these two edges. But when our cut is parallel to the cleavage line, we don't have any gap, we don't have any delay in the healing, and we cannot see any scar tissue after that. So it's important consideration for the time of surgery. These fibers are very important for characteristic of the skin. The collagen fiber are important for tensile strength. The elastic fibers can allow stretch and recoil. If the skin stretch beyond its capacity, some of these collagen fibers and elastic fibers are torn. And the result of this tearing are these stretch mark, which you can see in this picture. These are a stretch mark, which we call them esteria. So when we are pregnant, when we gain weight, sometimes these elastic and collagen fibers should tolerate more pressure than normal, and they are breakdown, and you can see these esteria or a stretch line here. We can diminish them by UV light, but sometimes they are not working. And the other important thing is about tattoos. The tattoos are permanent images which we make in the integument. They are dye which are injected into our dermis, and most of the times they are impossible, and it's impossible to remove them completely. But sometimes by some inks or some UV radiation and laser therapy, we can break down the pigment and we can remove tattoos. After the dermis, we have the other layer, which we call it subcutaneous layer. The subcutaneous layer is actually the areolar, and also look at the picture. Here you can see the subcutaneous layer, which is the areolar connective tissue and adipose connective tissue. And it's not a part of our integument. In this connective tissue, we have many fibers like reticular fibers, and they can pad and protect our body. They can act as the energy reservoir, and they can provide the thermal insulation for our body. This areolar and adipose connective tissue is full of blood vessels. And as you know, the adipose tissue are highly vascularized tissue, and we can use this part as a site of injection. So when we want to have subcutaneous injection, we need to insert our needle up to here, and we can do the injections here. The sexes have different layers different thickness for subcutaneous layer. It's thicker in women. In women, it accumulates in the breast, butt, hip, and thighs, but it's thinner in men and accumulates mostly in the neck, upper arm, abdomen, lower back, and butt. So these are the distribution of these adipose tissue or these subcutaneous fat in different regions of our body. And here in this diagram, you can see the different layers of the skin. Here you have the epidermis with stratum basale, spinosome, granulosome, lucidum, and corneum. And you can see the description of each layer. After that, we have the dermis. In the dermis, the superficial layer is papillary layer, and this is the areolar connective tissue, and the deep layer is a reticular layer, which is the dense irregular connective tissue. And after that, we have subcutaneous layer, which is located beneath our integument. It's not considered as a part of our skin, and it's areolar connective tissue and adipose connective tissue. In this part, you can answer these questions. The dermal papilla are part of what layer of the skin? And should a surgeon generally cut perpendicular or parallel to cleavage line? And what two types of tissue can form our subcutaneous layer? Now, I want to talk about the function of the integument. One of the important functions of the integument is protection. The epidermis can act as a physical barrier that protects the entire body from injuries and trauma. It offers protection against harmful chemicals, toxins, microbes, excessive heat, or cold. The skin also protects deeper tissue from solar radiation, specifically UV radiation. When exposed to the sun, the melanocytes become more active and they can produce more melanin, so they can give the skin a tanned look. Even when you get a sunburn, the deeper tissue remains unaffected. Only your skin changes its color. The other function of the skin is prevention of water loss and water gain. The epidermis is water resistant, but not entirely waterproof. Some water is always lost through the skin when you sweat. More water is typically lost through transpiration. And this is a process which the fluid slowly penetrates through the epidermis and then evaporate into the surrounding air. We realize how important the skin is in preventing water loss when treating individuals with severe burns. One of the main dangers is a dehydration when we have burns, because without the protective skin barrier, a much larger amount of water can escape from the body tissues. The skin also prevents water gain. If the skin were not water resistant, then each time you took a bath, you would swell up like a sponge as the skin absorbs water. The other function of the skin is metabolic regulation. Vitamin D3, which we call it cholecalciferol, is synthesized from a steroid precursor by a keratinocyte when they are exposed to UV radiation. Vitamin D3 is then released into the blood and transported to liver, where it's converted to another intermediate molecule, which we call it calcitriol. Calcitriol is the active form of vitamin Calcitriol is the active form of vitamin D3, and it's formed in our kidney. And we considered this as a hormone too. And I will talk about this hormone later for you. Let me see if I don't have any picture to show you in this PowerPoint. So the other function of our skin is making vitamin D for us. And you know that the vitamin D can increase absorption of calcium ion and phosphate from the small intestine into the blood, which result in a greater amount of calcium being absorbed from the food which we eat. So when we don't have enough vitamin D, the calcium cannot be reabsorbed. It's important to make enough vitamin D by sun exposure. The synthesis of vitamin D is very important in regulation of the level of calcium and phosphate in the blood. And during the day, we need to have the direct sunlight about 10 to 15 minutes, and our body can make enough vitamin D. The other function of our skin is secretion. Our skin can do secretion and also absorption. The skin exhibits a secretory function when it discharges substances from the body during sweating. Sweating occurs to release excess heat from our body. And pay attention that the sweat sometimes feels gritty because of the waste product being secreted onto the skin surface. The substances secreted in sweat include water, salt, and urea. And urea is a nitrogenous waste product of amino acid breakdown or protein breakdown. The amount of water, salt, and urea secreted can be adjusted by the skin, and the skin is very important for a regulation of electrolyte in our body. So it's important for electrolyte homeostasis. The sebum, which is secreted by the sebaceous gland, can lubricate the epidermis and also our hair and help make the integument be water resistant. The other function of our skin is absorption. The skin can absorb certain chemicals and drugs, such as estrogen from the birth control patches or nicotine from the nicotine patch, which we put it under the skin. We refer to the skin as being selectively permeable because some material are able to pass through it, whereas the others are effectively blocked. In a process called transdermal administration, drugs that are soluble either in oil or in lipid-soluble carriers can be administered transdermally by an adhesive patches which we can use in the skin. Drugs administered in this way slowly penetrate the epidermis and can be absorbed into our blood vessels of the dermis. Transdermal patches are specifically useful because they can release a continual, slow absorption of drug into our blood over a long period of time. The barrier to the drug diffusion through the epidermis requires that the concentration of the drug in the patch be relatively high. So this drug can do diffusion and come inside. The other function of the skin is immune function. And in skin, we have some dendritic cell, epidermal dendritic cell in stratum spinosum, which can initiate the immune response against pathogen, and they can attack cancer cells. And also in the dermis, we have some dendritic cell or some macrophages which can fight with the pathogen if they penetrate through epidermis. The other function of our skin is temperature regulation. This temperature regulation can be done by capillaries and the sweat gland which we have in the dermis. The dermal blood vessels can play an important role in our body temperature and also in our blood pressure. The vasoconstriction means the blood vessels start to become smaller and narrow, so less blood can pass through them. When less blood passing, they can keep heat in our body, and they can send more blood to the internal part of our body. And when we have vasodilation, the diameter of the blood vessel increase, more blood can travel to the skin, and when we have it, the result is a reddish pink skin and flushed face during exercise. And our skin has some sensory reception. The dermis of the skin has an extensive innervation, which refer to its distribution of nerve fibers. Sensory nerve fibers in the skin, which we call them sensory receptors, monitor each stimulation in both the dermis and epidermis. The tactile cell or Merkel cell are large, specialized epithelial cells that stimulate a specific sensory nerve ending when they are distorted by fine touch or pressure. In fact, 7 major types of sensory receptors are housed within our skin to detect, distinguish, and interpret the many stimulation of our external environment that interact with our skin. The motor nerve fiber extend through the skin to control the glandular secretion and the blood flow of the skin. So they are very important for our senses too. And now you can answer these questions. What are the active form of vitamin D and where it is synthesized? In the next part, I will talk about the skin derivatives.